The anterior approach is a minimally invasive approach to the hip for a total hip replacement. When somebody has a traditional hip replacement, they would have to go either through the gluteus maximus, which is the largest muscle in your body, or the lateral approach, which is through the big tendon of the hip, and that is just more disabling. When you cut the major structures of the hip, it just causes more post-operative pain and limp and disability. So the direct anterior approach is actually a true minimally invasive approach. You're not cutting any muscle, you're moving muscle out of the way to get into the hip joint. And I've perfected it now where it's now being done through anywhere between a 2.5 to a 3.5 inch incision. Most of my patients go home the next day. I've had several patients actually go home the same day after surgery. After a traditional hip replacement, you will have limitations as to what you can and cannot do in regards to bending over, keeping your feet crossed, keeping your feet open. There's all these restrictions as to what you can and cannot do, especially in the first 2 to 3 months after surgery. With the anterior approach, there's absolutely no restriction. You can do whatever you would like without fail.